Hello, my name is Morgan Smith from Santa Fe College for HIM 2810C, and this is Healthcare in Correctional Facilities. Obtaining routine healthcare is something that many people tend to take for granted because it's always available when we need it. But what if that was not the case? What if you were incarcerated? Would you have access to the same healthcare that someone outside of a correctional facility would have? The need for effective healthcare in a correctional facility is just as important as it would be for someone who is not incarcerated. This presentation will cover what are the costs of care in a correctional facility and how effective care can be provided on a limited budget. What is a correctional facility? A correctional facility is a facility that is used by federal and state criminal justice facilities. These facilities oversee individuals that are in a state of incarceration, rehabilitation, parole, or probation. This presentation will focus on facilities who oversee individuals who are incarcerated. Incarceration is when individuals known as inmates are detained in facilities because they are involved in committing a crime. The majority of these inmates either go to jail or prison. Jails are for those who are awaiting trial or sentencing, while prisons are for those who have been convicted of a crime and are serving their sentence. There is another type of facility that an inmate could potentially go to, and that is called solitary confinement, which is for inmates who pose a threat to others. An example of a correctional facility local to Santa Fe College is the Alachua County Jail. This is ran by the Alachua County Sheriff's Office, with agency executive Sheriff Sadie Darnell. Health services are provided by a third party called Horizon Health. Population statistics in March 2018 are there were 461 felony pretrial inmates, 34 misdemeanor pretrial inmates, what makes the pretrial inmate population a total of 68.2%. The average population as of March 2018 is 726. This next slide shows pictures of the Alachua County Jail. The state of Florida has a Correctional Medical Authority, also known as CMA. Their mission is to monitor and promote delivery of cost-effective health care that meets accepted community standards to inmates in the Florida Department of Corrections. Appointed by the governor, there are 7 board members who serve 4 years on a volunteer board of the CMA. The CMA also consists of 6 full-time employees. These employees utilize contractors outside to conduct surveys at the healthcare facilities within correctional facilities every 3 years. These surveys are evaluated, and if necessary, they are given a correction action plan. These standards are also governed by some Florida state statutes. There do not seem to be any specific federal regulations that correctional facilities have to follow regarding healthcare. However, the National Commission on Correctional Healthcare does outline some federal clinical guidelines. These guidelines link to the guidelines of major health departments and institutes. An example would be federal clinical guidelines linked to the Center for Disease Control and Prevention for guidelines regarding sexually transmitted diseases in persons in correctional facilities and in pregnancy. The federal clinical guidelines also link to the National Heart, Lung, and Blood Institute. Since the correctional facility is not a normal healthcare facility, there are different documentation requirements that differ from traditional facilities. The Department of Justice has an entire manual dedicated to healthcare in correctional facilities. In this manual, Chapter 12 is dedicated to data management and documentation. Within this chapter, there are 4 major sections. They are the Policies and Procedures Manuals, the Health Record, Administrative Information Needs, and Data Collection and Management. One of the first major requirements is that if the facility does not have a policy and procedures manual, then one will need to be developed. There are also several key elements that must be included in this policies and procedures, and some of them are the date they go into effect, the name of the department, the application, the policy itself, as well as references. When it comes to the health record, the Department of Corrections has established a framework that is used across all institutions. This format follows the American Public Health Association, APHA, and the National Commission on Correctional Healthcare, NCCHC. It follows both of their standards. The recommended format is a problem-oriented medical record, or POMR. This has 4 sections. The database, which includes patient history and assessment information. It includes the problem list, treatment plans, and progress notes. The budget for healthcare and correctional facilities is one of the biggest limiting factors, as it is with any healthcare facility. The budget is such a major factor that the governor of Florida, Ron DeSantis, has proposed a $120 million increase to prison budgets to cover healthcare. This is happening in many states. In Florida, this increase would bring the entire budget for the Department of Corrections to $2.7 billion, with only approximately 3% of the budget to include healthcare. That's $14 million for pharmaceuticals, $37 million for inmates for treatment of hepatitis C, and $86 million to enhance inmate health services. Additionally, Federal Bureau of Prisons allows facilities to charge inmates for medical services. According to an analysis done by the Brennan Center for Criminal Justice at New York University School of Law, in 2015, there were 35 states that allow inmates to be charged a copay or fee for medical services. These copays and fees help offset the need for a higher budget while increasing patient care. What are the accreditation and licensure requirements for correctional health care? The National Commission on Correctional Healthcare has standards that they call a framework for quality. The standards are a foundation of the National Commission on Correctional Healthcare's accreditation process. The process of receiving accreditation by the NCCHC is an external peer review in which they grant public recognition to the facilities that meet the nationally established and accepted standards. A few of the standards that are required for accreditation are governance and administration, safety, personnel and training, health promotion, special needs and services, and health records. In addition to the accreditation process, health professionals can become certified by the National Commission on Correctional Healthcare. The program offered is called Certified Correctional Health Professional, CCHP. Anyone who obtains a CCHP may also opt to have an advanced certification. The advanced certification options are simply advanced certification or specialty options, such as mental health professionals, registered nurses, or physicians. The coding requirements for correctional facilities are pretty vague. While researching, I found it difficult to find information regarding the use of medical codes in correctional facilities. However, through my past research, I have learned that the cost of healthcare often come from the state's budgets, or they can come from inmates being charged a fee or copay. Therefore, correctional facilities may not use medical codes, since these fees are not paid for by insurances. Codes may be used if an inmate does receive care on outside facilities, such as if they need to go to the hospital. There are specialized codes, such as Y92.14, to indicate that the place of occurrence is a prison. Even though a lot of the requirements for correctional facilities are different than normal facilities, medical records seem to be a standard requirement amongst all facilities. Care being provided in a correctional facility still needs to be documented as it would in any other healthcare facility. Therefore, correctional facilities must create and maintain a medical record. There are no requirements regarding unified records. Therefore, some facilities choose to keep separate records regarding each major discipline, such as psychiatry or neurology. Also, there are no requirements regarding electronic health records, so a health facility within a correctional facility may choose to either keep a paper record or electronic record. However, the NCCHC does recommend that electronic health records are used to help reduce errors. Additionally, inmates do not have access to their records. They do not have the right to them due to the fact that there are protected information within the records that could put the facility or other inmates at risk. On this slide, you see 3 different versions of electronic health records. The first one is AthenaNet, and then there is eClinicalWorks and Epic. And a fun fact, Epic health records are what is used at UF Health Shands Hospital here in Gainesville as well. In conclusion, incarceration is an unfortunate event in someone's life and often causes a major change and disruption. This does not mean that their health care has to suffer. They deserve the same health and treatment that they would whether they were in a correctional facility or in a normal doctor's office. Several institutions support the healthcare in correctional facilities, and it is a growing concern amongst state governments. Legislatures are beginning to notice these discrepancies and finding a way to better the care as a whole. Laws and budgets are being awarded for healthcare to help improve care. These are questions that you should be able to answer after watching my presentation. And here are my references if you choose to do more research. Thank you for watching.